Hello, this is Dr. Lewerenz, Longevity Health Institute. Hope this finds you well. Good evening or afternoon or whenever you're catching me here in the evening in early February 2021. Can't believe I'm saying that. But hey, let's talk about some exciting things here in the practice that are new or fairly new, and what we're doing with them and what we can do to impact your life and why we're using these. And I'm going to answer a few questions that have been messaged us on our YouTube channel and our Facebook page. So hopefully you subscribe, you track and follow me. I put up videos, usually 1 or 2 a week, or average at least. And you can always message me too. People do. I do eventually get them, and about topics you'd like me to talk about in here. And it can be anything from literally sex to weight loss, to energy, to cancer, to diabetes, to brain health, to cardiovascular health, to just being optimal, thriving, or maybe some new research or some in vogue kind of new trends that are out there and what my thoughts are. So the thing is this, you've heard me talk about and hopefully watched a previous video about our brain fitness, our WAVI EEG device that actually really looks at your quality of brain function, and I call it brain fitness, or like a cognoscopy, which is like a screening for your brain health. And it's a little bit of a tedious kind of modern EEG, looks at brain voltage and power and speed, which are called evoked potentials, and reaction time, and that in kind of P300, which are a metric for like how you respond to noises and sounds, and reaction time to hearing noises and sounds. Take home message there is how important your hearing and capability of hearing is as you age. There is studies that show that when hearing declines, actually brain health and fitness declines. So, but I want to talk about something in that test that we do that gives us a metric that we can really not just look at and kind of follow over time, but also we know where the cutoff is, where your executive function, your ability to perform tasks that are, needing some skills, some reaction time, some thought process, like driving or operating machines, or that you really should be suspect and considered in this has to be on your radar because of dementia coming, or how do you judge that? So it's a sophisticated test that gives us a number about this executive function. And if you're, it's called trail making, and it has to do with mapping letters and numbers. If that's off, then we know that yes, you might have some early cognitive decline or early dementia, and we need to screen you further. But maybe there's something, if you will, that's clogging up or jamming up the brain health, in your brain speed. So maybe you don't notice anything, maybe you do slightly, maybe relatives, friends, family do, but we're able to then pinpoint what the issue could be, and we dive and dig deeper. And I'll give you an example. So common things that do affect brain reaction time and speed and function are nutrients. And so we look at your nutrient levels at a cellular level. We also look at your heavy metals and toxins at a cellular level, not just what's circulating in your serum, but what's in essentially your fat and potentially bone, and yes, brain and cardiovascular. Big links, by the way, big links to heavy metals, and you've heard in previous videos, and I go into details about this. But cognitive decline, neurodegenerative disease, and neurocardiovascular disease. Your autonomic nervous system gets dysfunctional, your cardiovascular system gets dysfunctional, and your brain health gets dysfunctional if you have heavy metals. We've screened heavy metals here for years, but when I have a WAVI or a neurologic test that gives me a metric that says that maybe your executive function's off, well, and then we need to deep dive into why. Could be a little bit hormones, could be nutrients, could be heavy metals. But this is then when we deep dive. Now, let me give you a little example too of something, actually two things that we've seen already and improved on here with patients, and actually their brain health improves objectively on a test like this, as well as subjectively. They'll report to us that they're a little bit sharper and they notice the difference. And they're pretty simple things. One is inflammatory and infectious disease can cause temporary but chronically deterioration in memory. So the extreme of this would be, neurodegenerative or neuroinflammatory infection like syphilis. But you can actually have herpes, or you can have shingles, or you can have Epstein-Barr virus. And those chronic inflammatory virus reactions in your body, or Lyme, by the way, they can cause an acute and chronic neurodegenerative condition. Cut out the fancy words, infections and viruses that are chronic, including Epstein-Barr, including herpes, and including shingles, okay, can cause a temporary and sometimes chronic brain decline. And part of patients will report that have this and know they have this, whether it's herpes or whether it's shingles, they will report that, not only do they feel crappy and tired and beat up, but they will report that they have brain fog when they get a flare, and they feel real run down and tired. But they're also literally like, say they're just not sharp, they're not quick. We've seen this on our WAVI tests here, and patients that and some patients don't even know, meaning they have chronic Epstein-Barr, and we have to then now treat their immune system and use something that actually specifically drives down their Epstein-Barr, okay, or it could be herpes, and work on that and why, okay. And then not only do they feel better energetically and their brain fog improves, but now when we do a WAVI repeat in 3 to 6 months, we can see that actually their brain speed improves. So our purpose of doing our WAVI brain tests and our brain fitness tests is, yes, obviously we want to diagnose and uncover something that is maybe uncomfortable or scary to talk about, like dementia, but we also want to be way ahead of the curve and be proactive about what could be causing early cognitive changes, like infections, like heavy metals, like maybe a nutrient that's deficient, a fat, etc. Okay, maybe gut health. I didn't mention that earlier. Okay. But then also we can repeat it and know that we're making a difference. And also we then have a metric to follow, or a baseline to follow, that let's say in 2 years we repeat it and we see a decline. Why? And what can we do and what's changed? Okay. So if we're blessed to live on this earth long enough and we are fortunate enough to be healthy, we want to make sure we're thriving and have a good brain, good memory, good immunity, good function, okay, know who we are, love others, love family, be able to enjoy what God's given us in family and life, and spread good word and message and wisdom to others. How do you do that if you don't have a good brain and a good cardiovascular system? End of the story, right? Remember I said I'd give you 2 things that can affect brain, and we see improvements. One, again, is, yes, infections, like chronic infections like viruses and herpes and shingles and heavy metals, Epstein-Barr. The other one is heavy metals. I want to give you a story. Now, the story is about myself, so I openly can talk about this, and it's kind of interesting. So I do heavy metal testing typically roughly once a year, because I want to be ahead of the curve and make sure that I don't harbor some of these chronic heavy metals. Now, you get these, and it's a long story about how, but basically you just get these in the world. You get exposures, whether you eat and drink out of tin or metal, or you get lead in some things, or lead in the air, or you drink out of a well, or you get bad water or food, and that can give you arsenic, and I'll give you some examples of this, or thallium that's in the ground. You can get these exposures and they can bioaccumulate. So often I say it's not if you're toxic, it's how toxic. So I like to look at this in myself even once a year or so, okay? And if something gets worse or changes, whether it's lead, mercury, arsenic, tin, thallium, gadolinium, I can go on, then work on getting it out, whether that's with gentle detoxes, oral chelators, or more aggressively, which we do here often very successfully, is IV chelators. Bottom line though is that my story is, my last one I did roughly about year and a half ago. The only thing I really had was tin, and I had gadolinium from a previous contrast test that I had years ago. Now there's more and more evidence that's building up that gadolinium is not healthy, and I'll cover that in another video, because gadolinium is a very common heavy metal that we discover in patients when we test. It's definitely not good for you, but we'll cover that later. But I only had tin, a very small amount. Now I do preventative chelation IV, at least 3 or 4, maybe even up to 6 per year preventatively, because of the benefits. But I went to Florida, I enjoyed 5 days, ate seafood, ate shellfish, okay, did a test, and unbeknownst to me, my arsenic off the charts. And thallium was very high too. But arsenic, all of a sudden, boom, off the charts. Highest reported possible, okay? So now, I think my wife loves me. And I know I love her, but unless I'm being poisoned, and I'm joking, of course, but, arsenic is in a lot of rice, especially if it's from Asia and China. And it's very commonly in shellfish, and I just indulged in a lot of seafood and shellfish in Florida. So I will do a repeat test to confirm this, and it could be a transient swing in arsenic, okay, because of that exposure. But what I did is a WAVI test to look at brain health on myself in brain speed and voltage in that. And if it's accurate, when that my arsenic is up and I have to chelate, I'm going to compare that WAVI. Now, my WAVI is not poor at all, but of course there always can be improvement, and we can always want to optimize and maximize things. So it'll be very interesting if this changes, even if it's just a few seconds in speed or 1 or 2 volts up from where it was, but it does show you the improvements you can get with heavy metals, okay? Now, it's very possible my arsenic is not going to be off the chart when I do a retest. It'll be there, but it tells me the exposure was there. I probably will do an IV chelator once or twice just to make sure it's out of me, but I want you to have the knowledge to know that it's in our world. It is there, and if you think that there is one reason why dementia is on the rise, or early cognitive decline or Alzheimer's, let me inform you, it's not one reason, but it's the exposure to toxins in our world and our environment excessively, decade after decade after decade. It is known and in studies linked to higher blood sugars. There's much more prediabetes, insulin resistance, and diabetes in our country. It's coming your way if you're not careful. It's in your families, it's in loved ones, okay? And any rise in blood sugar is a rotter of your brain, okay? The other thing is that your blood in your body and your circulation in your body does not stop here. So if you have any form of cardiovascular health issues, blood pressure, early heart disease, or severe heart disease, that is happening here. To what degree a WAVI test defines that? And then we dissect and improve the root cause so that we can improve the blood flow and why this happened, okay? And just like heart health, we can stabilize and improve brain health. So hopefully this is enlightening how nutrients, infections, heavy metals, and circulation affect your whole body, whether it's cardiovascular-wise, and endothelium and microcirculation, or if it's neurodegenerative with your brain, okay? So share this with others. Watch my other previous videos. We're always happy to bring in new patients, me and my providers, to bring you the best in personalized functional medicine, or just what I like to call the best of medicine. And the last message that I want to cover, because it was a question, is that our tests, our WADI tests, our blood pressure tests, our central blood pressure, autonomic tests for circulation, for brain and cardiac health, are covered and billed through insurance. Obviously, everybody's insurance depends on coverage, and deductibles and copays are all unique to the individual. That's your responsibility to look into, but it is something that is a insurance covered billable service. And it's very high end and very, very, very advanced. So hopefully this helps you, enlightens you, share with others, and let's keep your brain and heart well, as we do here at Longevity Health Institute. Dr. Lewerenz, be well.